So the purpose of this trial was to assess whether or not ambulatory hemodynamic monitoring with the pulmonary artery sensor could impact mortality in patients with heart failure. Preliminary studies have suggested that ambulatory pressure monitoring can in fact improve survival in patients with heart failure. So this was one of the first studies of a pulmonary artery sensor to assess that question. We used the CardioMEMS wireless pulmonary artery sensor and monitoring system in this trial. The study design was a retrospective cohort propensity matched study in which patients who received a CardioMEMS sensor were compared retrospectively to patients who did not receive the sensor. We used Medicare data and identified these treated patients over a specified time interval, and then performed a very detailed and robust matching procedure so that we were able to closely match on a one-to-one basis each treatment patient with a control patient. The major finding of the study is that mortality was reduced by 30% and the rate of heart failure hospitalization was reduced by 24%. I think the message for clinical practice is that the CardioMEMS sensor is very effective in real-world patients, and that further studies are needed to determine in a prospective, randomized fashion whether use of ambulatory monitoring from hemodynamic monitoring can reduce mortality.